Phlebotomy Certification Exam Full Mock Test. Question 1. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider while preparing a CBC specimen in the preoperative testing area? Option A. Possible arterial puncture. Option B. Proper venous flow. Option C. Tube additive carryover. Option D. Normal capillary refill. The correct answer is option A. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Typical venous flow is darker and not pulsatile. Additive carryover affects specimen chemistry, not blood pulsation. Capillary refill is assessed in tissue color return, not tube blood flow. Question 2. In the Oncology Infusion Center, which tube is collected first when blood cultures are ordered with other venipuncture tubes in the Oncology Infusion Center during a clinical simulation? Option A. Lavender EDTA tube. Option B. Blood culture bottles or sterile culture tube. Option C. Gray fluoride tube. Option D. Serum separator tube. The correct answer is option B. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. EDTA tubes are collected later to prevent additive carryover. Gray tubes are generally collected after other additive tubes. Serum separator tubes do not take priority over sterile blood culture collection. Question 3. In the standard venipuncture order of draw, which tube usually follows blood cultures while preparing a basic metabolic panel specimen in the dialysis adjacent clinic? Option A. Lavender EDTA tube. Option B. Gray fluoride tube. Option C. Light blue sodium citrate tube. Option D. Royal blue tube for every test. The correct answer is option C. Light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. EDTA is collected later because it can interfere with coagulation and chemistry tests. Gray fluoride tubes are usually near the end of the order. Royal blue tubes are used for specific trace element testing, not as the universal second tube. Question 4. To protect patient safety, which order is most appropriate for collecting blood cultures, light blue, serum, green, lavender, and gray tubes while preparing a blood culture specimen in the student skills lab? Option A. Lavender, gray, green, serum, light blue, blood cultures. Option B. Gray, lavender, green, serum, light blue, blood cultures. Option C. Serum, lavender, blood cultures, gray, light blue, green. Option D. Blood cultures, light blue, serum, green, lavender, gray. The correct answer is option D. Blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Starting with lavender risks EDTA contamination of later tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Placing cultures after non-sterile tubes increases contamination risk. Question 5. Why does order of draw matter during evacuated tube collection while preparing a fasting glucose specimen in the occupational health clinic? Option A. It helps prevent additive carryover from altering later specimens. Option B. It makes patient identification optional. Option C. It eliminates the need to mix tubes. Option D. It determines the patient's fasting status. The correct answer is option A. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Patient identification is required regardless of tube order. Additive tubes still need proper mixing after filling. Fasting status is based on patient preparation, not tube sequence. Question 6. During capillary puncture, which specimen type is generally collected first when ordered while preparing a type and screen specimen in the blood collection station? Option A, serum specimen. Option B, blood gas specimen. Option C, gray top microtube. Option D, non-additive tube after all others. The correct answer is option B, blood gas specimen. Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Serum is not first when blood gases are ordered. Gray microtubes are collected after more time-sensitive capillary specimens. Non-additive tubes are not automatically collected first in capillary order. Question 7. In a routine phlebotomy scenario, which capillary collection order is commonly used after blood gases when EDTA testing is ordered while preparing a lipid panel specimen in the outpatient clinic? Option A, serum microtube before EDTA for every draw. Option B, gray microtube first even when blood gases are needed. Option C, EDTA microtube before other additive and serum microtubes. Option D, any order because capillary tubes have no additives. The correct answer is option C, EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Serum first collection can allow clotting before the EDTA specimen is filled. Blood gases are more time-sensitive and generally come first if ordered. Many capillary tubes contain additives, so order still matters. Question 8. Before proceeding with the draw, which tube is most appropriate for a routine CBC while preparing a troponin specimen in the hospital unit during morning rounds? Option A, light blue sodium citrate tube. Option B, gray sodium fluoride tube. Option C, red no additive tube. Option D, lavender top tube containing EDTA. The correct answer is option D, lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. Citrate is used mainly for coagulation testing. Gray tubes are commonly used for glucose or lactate preservation. A red tube allows serum testing and is not the standard choice for CBC. Question 9. During a final review, which additive is found in a light blue tube used for patient and APTT testing while preparing a thyroid panel specimen in the urgent care laboratory? Option A, sodium citrate. Option B, EDTA. Option C, sodium fluoride with potassium oxalate. Option D, lithium heparin. The correct answer is option A, sodium citrate. Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. EDTA is used mainly for hematology and can interfere with coagulation testing. Fluoride/oxalate is used mainly to preserve glucose or lactate. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. Question 10. In the pediatric clinic, which tube is commonly selected for many serum chemistry tests when gel separation is desired in the pediatric clinic during a study session? Option A, lavender EDTA tube. Option B, serum separator tube with clot activator and gel. Option C, light blue citrate tube. Option D, gray fluoride tube only. The correct answer is option B, serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. EDTA plasma is not serum and can interfere with some chemistry tests. Citrate plasma is intended primarily for coagulation testing. Gray tubes preserve glucose but are not the general serum separator choice. Question 11. For a electrolyte panel collection, which tube is commonly associated with heparinized plasma chemistry testing in the long-term care unit during a structured exam prep drill? Option A, lavender top tube. Option B, light blue top tube. Option C, green top tube. Option D, pink top tube. The correct answer is option C, Green top tube. Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Lavender tubes contain EDTA for hematology. Light blue tubes contain citrate for coagulation testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Question 12. To protect patient safety, which tube is most commonly used for glucose preservation when testing may be delayed while preparing a therapeutic drug level specimen in the mobile collection site? Option A, plain red tube only. Option B, light blue citrate tube. Option C, blood culture bottle. Option D, gray top tube with sodium fluoride and an anticoagulant. The correct answer is option D. Gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. A plain red tube does not contain glycolysis inhibitor. Citrate is used for coagulation studies, not routine glucose preservation. Blood culture bottles are for detecting microorganisms, not preserving glucose. Question 13. After reviewing the order, which tube is commonly used for blood bank testing such as type and screen while preparing a bilirubin specimen in the emergency department bay? Option A, pink top EDTA tube. Option B, gray top fluoride tube. Option C, light blue citrate tube. Option D, green heparin tube for every blood bank test. The correct answer is option A. Pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Gray tubes are associated with glucose or lactate preservation. Light blue citrate tubes are for coagulation testing. Green heparin tubes are not the routine tube for type and screen. Question 14. When preparing for collection, which tube is generally collected for a blood culture specimen while preparing a ammonia specimen in the physician office lab? Option A, lavender EDTA tube only. Option B, sterile blood culture bottle or SBS containing culture tube according to policy. Option C, gray fluoride tube. Option D, SST after clotting. The correct answer is option B. Sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. A lavender tube is not designed as the primary blood culture container. A gray tube preserves glucose and does not support blood culture protocols. An SST is for serum separation, not microorganism culture. Question 15. Why must a light blue citrate tube be filled to the proper level while preparing a lactate specimen in the community health screening event? Option A. The tube color changes if underfilled. Option B, EDTA needs extra room to mix. Option C. The blood to anticoagulant ratio must be correct for coagulation results. Option D, serum cannot clot unless the tube is full. The correct answer is option C. The blood to anticoagulant ratio must be correct for coagulation results. Coagulation testing depends on a precise citrate to blood ratio, commonly described as 1 part citrate to 9 parts blood. Tube color does not change to warn of underfilling. EDTA is not the additive in a light blue citrate tube. Light blue tubes contain anticoagulant and are not collected to obtain serum clotting. Question 16. After collecting an additive tube, how should it usually be mixed while preparing a CBC specimen in the preoperative testing area? Option A, shake it hard until bubbles appear. Option B, leave it unmixed until centrifugation. Option C, open the stopper and stir with a wooden applicator. Option D, gently invert the tube the recommended number of times. The correct answer is option D. Gently invert the tube the recommended number of times. Gentle inversion evenly distributes additive while reducing cell trauma. Vigorous shaking can cause hemolysis. Failure to mix can allow clotting or poor additive action. Opening a tube risks exposure, contamination, and specimen loss. Question 17. During a scenario, which problem can occur if a lavender EDTA tube is not mixed soon after filling while preparing a patient/INR specimen in the Oncology Infusion Center? Option A. Microclots may form and make hematology results unreliable. Option B. The tube becomes sterile for culture. Option C. The specimen turns into serum. Option D. The sodium citrate ratio improves. The correct answer is option A. Microclots may form and make hematology results unreliable. EDTA must contact the blood promptly to prevent clot formation in hematology specimens. Mixing does not create sterility for culture testing. A lavender tube is intended for anticoagulated whole blood or plasma, not serum. Sodium citrate is not the additive in a lavender EDTA tube. Question 18. In the dialysis-adjacent clinic, which practice helps reduce hemolysis during a routine basic metabolic panel collection in the dialysis-adjacent clinic during a competency review? Option A. Force blood rapidly through a small needle. Option B. Use appropriate needle size and gently invert tubes instead of shaking them. Option C. Shake additive tubes vigorously. Option D. Pull back a syringe plunger as hard as possible. The correct answer is option B. Use appropriate needle size and gently invert tubes instead of shaking them. Gentle handling and appropriate equipment reduce red blood cell rupture. Forcing blood through a small needle can damage cells. Vigorous shaking is a common cause of hemolysis. Excessive syringe force can rupture cells and compromise results. Question 19. For a blood culture collection, which laboratory result is especially affected by hemolysis because red cells release intracellular contents in the student skills lab during a final review? Option A. Patient date of birth becomes invalid. Option B. Tube expiration date is extended. Option C. Potassium may be falsely increased. Option D. Tourniquet pressure becomes lower. The correct answer is option C. Potassium may be falsely increased. Hemolysis releases intracellular potassium from red blood cells and can falsely elevate measured potassium. Patient demographics are not changed by cell rupture. A specimen problem cannot extend tube expiration. Tourniquet pressure is unrelated to the analyzer result after hemolysis. Question 20. When using a syringe for blood transfer, which method best protects specimen quality while preparing a fasting glucose specimen in the occupational health clinic? Option A. Remove the tube stopper and push blood in forcefully. Option B. Squirt blood through the needle into each tube. Option C. Shake each tube hard to remove clots. Option D. Use a safety transfer device and allow blood to flow gently into tubes. The correct answer is option D. Use a safety transfer device and allow blood to flow gently into tubes. A safety transfer device reduces needle stick risk and minimizes pressure-related cell damage. Removing stoppers increases exposure and contamination risk. Pushing blood through a needle can cause hemolysis and Sharp's injury. Shaking tubes can rupture cells and worsen specimen quality. Question 21. Why should alcohol be allowed to dry before puncture while preparing a type and screen specimen in the blood collection station? Option A. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Option B. Dry alcohol makes the tube additive stronger. Option C. Wet alcohol improves vein anchoring. Option D. Alcohol drying replaces tourniquet use. The correct answer is option A. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Air drying supports proper antisepsis and prevents wet alcohol from entering the specimen path. Drying does not change the chemical strength of tube additives. Vein anchoring depends on hand technique, not wet alcohol. Tourniquet use is a separate step for vein distension. Question 22. When preparing for collection, which specimen often requires protection from light after collection while preparing a lipid panel specimen in the outpatient clinic? Option A. CBC specimen for platelet count. Option B. Bilirubin specimen. Option C, routine sodium citrate coagulation tube. Option D, blood culture bottle during incubation. The correct answer is option B. Bilirubin specimen. Bilirubin is light sensitive and may decrease if the specimen is exposed to light. CBC specimens require mixing and timely testing, not routine light protection for platelet count. Citrate coagulation specimens require correct fill and processing, not light protection as the key issue. Blood cultures require sterile handling and incubation, not wrapping for light protection as the primary step. Question 23. In a routine phlebotomy scenario, which specimen commonly requires rapid transport on ice or chilled handling according to policy while preparing a troponin specimen in the hospital unit during morning rounds? Option A, routine CBC kept for the next day. Option B, serum separator tube for a lipid panel after clotting only. Option C, ammonia specimen. Option D, blood culture bottle placed in the freezer. The correct answer is option C. Ammonia specimen. Ammonia specimens are time-sensitive and commonly require chilling and prompt processing. A routine CBC should not simply be held for the next day without stability guidance. A lipid panel does not share the same immediate chilled handling requirement as ammonia. Blood culture bottles should not be frozen because organisms must remain viable for detection. Question 24. Before proceeding with the draw, which action best maintains specimen integrity during transport to the laboratory while preparing a thyroid panel specimen in the urgent care laboratory? Option A, store every specimen at room temperature overnight. Option B, centrifuge every tube immediately regardless of type. Option C, place all blood specimens in direct sunlight. Option D, follow required time, temperature, light, and handling instructions for the ordered test. The correct answer is option D. Follow required time, temperature, light, and handling instructions for the ordered test. Different tests have specific stability requirements, so handling must match the test and facility policy. Overnight room temperature storage can make many specimens unacceptable. Some tubes should not be centrifuged immediately or at all before required steps. Sunlight can degrade light-sensitive analytes and warm specimens. Question 25. If a specimen must be transported cold, which approach is appropriate while preparing a hemoglobin A1C specimen in the pediatric clinic? Option A, place the specimen in the approved cooling method without direct water contamination. Option B, submerge the tube in loose ice water. Option C, hold it in a bare hand to keep it visible. Option D, place it near a heater until pickup. The correct answer is option A. Place the specimen in the approved cooling method without direct water contamination. Cooling must preserve the required temperature while protecting the label and tube from contamination or leakage. Loose ice water can damage labels and create contamination issues. Holding the specimen warms it and defeats the cold requirement. A heater can destabilize temperature-sensitive analytes. Question 26. In the long-term care unit, which situation is a common reason for specimen rejection in the long-term care unit during a practice drill? Option A, collector wore gloves. Option B, wrong tube type or insufficient specimen volume. Option C, patient stated date of birth. Option D, tube was labeled at the bedside. The correct answer is option B. Wrong tube type or insufficient specimen volume. Wrong container choice or inadequate volume can prevent accurate testing and may require recollection. Wearing gloves is expected when blood exposure is possible. Patient-stated identifiers support accurate identification. Bedside labeling is the correct practice. Question 27. Why should tube expiration dates be checked before collection while preparing a therapeutic drug level specimen in the mobile collection site? Option A, expired tubes identify patients faster. Option B, expired tubes prevent hemolysis in every case. Option C, expired tubes may have inadequate vacuum or unreliable additive performance. Option D, expired tubes are required for coagulation testing. The correct answer is option C. Expired tubes may have inadequate vacuum or unreliable additive performance. Tube vacuum and additive quality can decline after expiration, compromising specimen volume or test accuracy. Expiration dates do not help verify identity. No expired tube can guarantee hemolysis prevention. Coagulation testing requires properly filled, unexpired citrate tubes. Question 28. A patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best while preparing a bilirubin specimen in the emergency department bay? Option A. Draw the specimen and write fasting on the label. Option B. Tell the patient not to mention the meal. Option C. Cancel every test without notifying anyone. Option D. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. The correct answer is option D. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Fasting status affects certain tests, so the discrepancy must be handled through policy and communication. Marking the specimen as fasting would be inaccurate documentation. Hiding the meal prevents proper interpretation of results. Canceling without communication may disrupt care and exceed the phlebotomist's role. Question 29. Why is fasting status important before some chemistry tests while preparing a ammonia specimen in the physician office lab? Option A. Food intake can alter analytes such as glucose or lipids. Option B. Food changes the patient's legal name. Option C. Fasting makes needles sterile. Option D. Fasting eliminates the need for tube mixing. The correct answer is option A. Food intake can alter analytes such as glucose or lipids. Some blood values vary after eating, so fasting helps standardize interpretation. Food intake does not affect patient identity. Sterility comes from equipment and technique, not fasting. Additive tubes still require proper mixing regardless of fasting status. Question 30. For a medication trough level, when is the specimen usually collected while preparing a lactate specimen in the community health screening event? Option A. Immediately after the medication is swallowed. Option B. Immediately before the next scheduled dose. Option C. At any random time during the day. Option D. Only after the medication is discontinued for a week. The correct answer is option B. Immediately before the next scheduled dose. A trough measures the lowest drug concentration, typically just before the next dose. Immediately after dosing reflects absorption or peak timing, not trough. Random timing can make therapeutic drug results difficult to interpret. Stopping medication for a week is not the routine way to collect a trough. Question 31. During a glucose tolerance test, why must collection times be followed carefully while preparing a CBC specimen in the preoperative testing area? Option A. Any time is acceptable if the tubes are gray. Option B. Timing only matters after the last tube. Option C. Timed results show how the body responds to a measured glucose dose. Option D. The patient should eat between timed draws to stay comfortable. The correct answer is option C. Timed results show how the body responds to a measured glucose dose. Glucose tolerance testing depends on comparing specimens at specific intervals after glucose administration. Tube type does not remove the need for precise timing. Every scheduled interval matters for interpretation. Eating during the test can invalidate the glucose response pattern. Question 32. Before proceeding with the draw, which documentation is especially important for a timed specimen while preparing a patient/INR specimen in the Oncology Infusion Center? Option A. The phlebotomist's favorite tube brand. Option B. Only the patient's room number. Option C. A note saying collected sometime today. Option D. Exact collection time recorded on the label or requisition according to policy. The correct answer is option D. Exact collection time recorded on the label or requisition according to policy. Time tests require accurate collection time so results can be interpreted correctly. Tube brand does not communicate timing. Room number is not a valid substitute for collection time. Vague timing can make the specimen clinically unreliable. Question 33. Before collecting blood cultures, why is careful skin antisepsis critical while preparing a basic metabolic panel specimen in the dialysis-adjacent clinic? Option A. It reduces contamination that could cause a false positive culture. Option B. It makes EDTA tubes clot faster. Option C. It eliminates the need for sterile bottles. Option D. It changes venous blood into arterial blood. The correct answer is option A. It reduces contamination that could cause a false positive culture. Blood cultures are highly sensitive to skin organisms, so antisepsis helps ensure organisms detected are clinically meaningful. EDTA clotting is unrelated to culture site preparation. Sterile collection containers are still required. Skin antisepsis does not change the type of blood collected. Question 34. When collecting blood cultures with other tubes, which priority is most important while preparing a blood culture specimen in the student skills lab? Option A. Collect cultures after gray tubes. Option B. Maintain sterility and collect cultures before non-sterile tubes. Option C. Touch the bottle tops after cleaning to confirm dryness. Option D. Use a non-sterile transfer cup. The correct answer is option B. Maintain sterility and collect cultures before non-sterile tubes. Blood cultures must be protected from contamination because false positives can lead to unnecessary treatment. Collecting cultures after other tubes increases contamination risk. Touching clean tops can recontaminate them. A non-sterile transfer process defeats the purpose of sterile collection. Question 35. If using a winged set for blood cultures, why is bottle order guided by facility policy while preparing a fasting glucose specimen in the occupational health clinic? Option A. The order determines the patient's identity. Option B. The order prevents the need to clean the site. Option C. Air in the tubing can affect which bottle should be filled first. Option D. The order makes the needle reusable. The correct answer is option C. Air in the tubing can affect which bottle should be filled first. Butterfly tubing contains air, and culture bottle order may be chosen to manage that air safely. Bottle order does not verify patient identity. Skin and bottle antisepsis are still required. Needles are single-use and cannot be reused. Question 36. For a legal blood alcohol collection, which requirement is especially important while preparing a type and screen specimen in the blood collection station? Option A. Use alcohol swabs for every blood alcohol specimen. Option B. Leave the specimen unlabeled until court. Option C. Let the patient carry the open tube to the lab. Option D. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. The correct answer is option D. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Legal specimens require strict identity, handling, and documentation controls to preserve admissibility and integrity. Alcohol antiseptic may contaminate alcohol testing and may be prohibited by protocol. Unlabeled legal specimens break traceability. Allowing the patient to carry an open specimen compromises custody and security. Question 37. After reviewing the order, which action best supports chain of custody for a drug screen specimen while preparing a lipid panel specimen in the outpatient clinic? Option A. Document each person who handles the specimen from collection to transfer. Option B. Use only verbal handoff with no signatures. Option C. Store the specimen in an unlocked public area. Option D. Discard the seal after collection. The correct answer is option A. Document each person who handles the specimen from collection to transfer. Chain of custody proves who had control of the specimen at each step. Verbal handoff alone does not create a traceable legal record. Unsecured storage can compromise specimen integrity. A broken or discarded seal weakens evidence of tamper control. Question 38. Why are tamper-evident seals used on forensic or workplace testing specimens while preparing a troponin specimen in the hospital unit during morning rounds? Option A. They replace patient consent. Option B. They help show whether the specimen was opened or altered after collection. Option C. They make refrigeration unnecessary for all tests. Option D. They prevent the need for a requisition. The correct answer is option B. They help show whether the specimen was opened or altered after collection. Tamper-evident seals support specimen integrity by making unauthorized opening visible. A seal does not replace required consent or authorization. Temperature requirements still depend on the test. A requisition or custody form is still needed for proper processing. Question 39. For an infant heel stick, which area is safest for puncture during a final review for a thyroid panel collection? Option A. Posterior curvature of the heel. Option B. Center of the arch. Option C. Medial or lateral plantar surface of the heel. Option D. Tip of the great toe. The correct answer is option C. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel avoids deeper structures when an appropriate lancet depth is used. The posterior curvature increases risk of bone injury. The arch is not an approved heel stick site. The great toe is not the standard infant heel stick site. Question 40. Why should an infant heel puncture not be too deep during a study session for a hemoglobin A1C collection? Option A. A deeper puncture always prevents hemolysis. Option B. Depth determines the tube color. Option C. A deep puncture replaces the need for warming. Option D. Excessive depth can injure bone or deeper tissue. The correct answer is option D. Excessive depth can injure bone or deeper tissue. Infants have small heels, and excessive lancet depth can damage underlying structures. Deeper puncture can increase injury and does not guarantee specimen quality. Tube color is selected by test requirements, not puncture depth. Warming is a separate step used to improve blood flow when appropriate. Question 41. During a structured exam prep drill, which finger is generally preferred for adult capillary puncture during a structured exam prep drill for a electrolyte panel collection? Option A. Middle or ring finger on the palmar surface near the side of the fingertip. Option B. Thumb pad for every test. Option C. Index fingertip in all adults. Option D. Little finger near the bone. The correct answer is option A. Middle or ring finger on the palmar surface near the side of the fingertip. The middle or ring finger usually has adequate tissue and less callus than other fingers. The thumb may be more calloused and is not the routine first choice. The index finger is often more sensitive and calloused. The little finger has less tissue over bone and higher injury risk. Question 42. After a finger puncture, why is the first drop of blood commonly wiped away during a clinical simulation for a therapeutic drug level collection? Option A. It contains only white blood cells. Option B. It may contain tissue fluid or contaminants that can affect the specimen. Option C. It proves the patient is fasting. Option D. It activates the tube vacuum. The correct answer is option B. It may contain tissue fluid or contaminants that can affect the specimen. The first drop can be diluted with tissue fluid or skin contaminants, so wiping it improves specimen quality for many tests. The first drop is not composed only of white blood cells. Fasting status cannot be determined from the first drop. Capillary collection does not depend on evacuated tube vacuum at the puncture site. Question 43. How can warming a capillary puncture site help collection during a review for a bilirubin collection? Option A. It sterilizes the skin completely. Option B. It removes the need to identify the patient. Option C. It increases local blood flow when used safely. Option D. It makes every specimen suitable for culture. The correct answer is option C. It increases local blood flow when used safely. Warmth can improve capillary blood flow and reduce the need for excessive squeezing. Warming does not sterilize skin. Patient identification is still mandatory. Capillary specimens are not automatically suitable for blood culture collection. Question 44. Why should excessive squeezing or milking be avoided during capillary collection during a mock exam for a ammonia collection? Option A. It improves all glucose results. Option B. It makes EDTA unnecessary. Option C. It prevents clotting in serum tubes. Option D. It can dilute the specimen with tissue fluid and cause hemolysis. The correct answer is option D. It can dilute the specimen with tissue fluid and cause hemolysis. Excessive pressure can alter specimen composition and damage cells. Glucose results can be affected by poor specimen quality rather than improved. EDTA is still needed when an EDTA microtube is required. Serum tubes are intended to clot and are not protected by squeezing. Question 45. When is dermal puncture commonly preferred over venipuncture during a skills check for a lactate collection? Option A. For some infants, small volume tests, or patients with difficult veins when appropriate. Option B. For every blood culture set. Option C. For all coagulation studies regardless of policy. Option D. Whenever patient identification is incomplete. The correct answer is option A. For some infants, small volume tests, or patients with difficult veins when appropriate. Dermal puncture can be useful when only small volumes are needed or venipuncture is difficult. Blood cultures usually require sterile venipuncture collection and adequate volume. Coagulation testing has strict specimen requirements and is not automatically dermal. Incomplete identification must be resolved before any collection method. Question 46. A child begins to pull away during a draw. Which action supports safety during a practice drill for a CBC collection? Option A. Continue while the arm is moving. Option B. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Option C. Scold the child until they stop. Option D. Ask another child to hold the arm. The correct answer is option B. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Safe positioning prevents sudden movement that could injure the child or phlebotomist. Continuing while the arm moves increases injury risk. Scolding is not therapeutic and can escalate fear. Another child is not appropriate assistance for a procedure. Question 47. In a routine phlebotomy scenario, which explanation is best for a young child before a finger stick during a scenario for a patient/INR collection? Option A. Tell the child nothing will happen. Option B. Use detailed adult medical terminology. Option C. Use simple honest words such as a quick pinch and explain what they can do to help. Option D. Promise a toy only if they do not cry. The correct answer is option C. Use simple honest words such as a quick pinch and explain what they can do to help. Age-appropriate honesty helps the child understand and cooperate without unnecessary fear. Saying nothing will happen is misleading. Complex terminology can confuse or frighten a young child. Tying a reward to not crying can shame a normal fear response. Question 48. For an older adult with fragile veins, which technique is most appropriate during a competency review for a basic metabolic panel collection? Option A. Slap the site hard to make veins appear. Option B. Use the largest needle available. Option C. Leave the tourniquet on for several minutes. Option D. Use gentle anchoring and consider a smaller needle or controlled collection device. The correct answer is option D. Use gentle anchoring and consider a smaller needle or controlled collection device. Fragile veins need careful stabilization and equipment that reduces trauma or collapse. Slapping can injure delicate skin and is unprofessional. A large needle can worsen trauma. Prolonged tourniquet time increases hemoconcentration and bruising risk. Question 49. Why should adhesive bandages be used carefully on some older adults during a final review for a blood culture collection? Option A. Fragile skin can tear when adhesive is removed. Option B. Adhesive changes the blood type. Option C. Older adults never need pressure after draws. Option D. Bandages prevent all anticoagulant bleeding. The correct answer is option A. Fragile skin can tear when adhesive is removed. Aging skin may be thin and easily damaged, so pressure wrap or gentle dressing choices may be needed. Adhesive has no effect on blood type. Older adults still need pressure until bleeding stops. A bandage does not eliminate bleeding risk, especially with anticoagulants. Question 50. Before assembling equipment for a fasting glucose draw, which item should be checked while preparing a fasting glucose specimen in the occupational health clinic? Option A. Only the color of the chair. Option B. Tube type, expiration date, needle safety device, and requisition requirements. Option C. The patient's favorite beverage. Option D. The brand of wall clock in the room. The correct answer is option B. Tube type, expiration date, needle safety device, and requisition requirements. Checking supplies before collection helps prevent wrong container use, expired tubes, and safety device problems. Chair color has no role in specimen acceptability. Favorite beverage is not part of collection equipment verification. The wall clock brand does not confirm correct supplies or orders. Question 51. For a type and screen collection, which sequence is safest after blood has entered the final tube while preparing a type and screen specimen in the blood collection station? Option A. Withdraw needle with tourniquet tight and no gauze ready. Option B. Activate safety device before removing the needle from the arm. Option C. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. Option D. Remove the needle and recap it before pressure. The correct answer is option C. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The final steps should reduce venous pressure, prepare for bleeding control, and secure the sharp immediately. Withdrawing with the tourniquet tight can increase bleeding and bruising. Most safety devices are activated after withdrawal unless the device instructions say otherwise. Recapping a contaminated needle creates sharp's injury risk. Question 52. To protect patient safety, which action should occur before leaving the patient after venipuncture during a clinical simulation for a lipid panel collection? Option A. Leave while blood is still oozing. Option B. Tell the patient to remove the bandage immediately. Option C. Dispose of sharps after walking to another room. Option D. Confirm bleeding has stopped and provide appropriate post-draw instructions. The correct answer is option D. Confirm bleeding has stopped and provide appropriate post-draw instructions. Post-draw assessment helps prevent bleeding, bruising, and delayed complications. Leaving active bleeding unattended is unsafe. Immediate bandage removal can restart bleeding. Sharps must be disposed of promptly in the collection area. Question 53. Why is patient positioning important before venipuncture during a review for a troponin collection? Option A. It reduces the risk of falls or injury if the patient becomes dizzy. Option B. It makes labeling unnecessary. Option C. It changes EDTA into citrate. Option D. It allows the needle to be reused safely. The correct answer is option A. It reduces the risk of falls or injury if the patient becomes dizzy. A seated or lying position with arm support protects the patient if syncope occurs. Proper positioning does not replace specimen labeling. Body position does not change tube additives. Needles are single-use and cannot be reused. Question 54. When preparing for collection, which patient instruction is appropriate after a routine venipuncture during a mock exam for a thyroid panel collection? Option A. Scratch the site if it feels itchy. Option B. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Option C. Remove the bandage while still bleeding. Option D. Bend the elbow tightly for 10 minutes. The correct answer is option B. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Post-draw instructions support clot formation and reduce bruising or bleeding. Scratching can disrupt the site and introduce contamination. Removing a bandage during bleeding can restart or worsen bleeding. Bending the elbow tightly can increase bruising. Question 55. In a routine phlebotomy scenario, which laboratory department commonly performs CBC testing while preparing a hemoglobin A1C specimen in the pediatric clinic? Option A. Microbiology only. Option B. Blood bank only. Option C. Hematology. Option D. Histology only. The correct answer is option C. Hematology. Hematology evaluates blood cells and commonly performs CBC testing. Microbiology focuses on organisms and cultures. Blood bank focuses on compatibility and transfusion-related testing. Histology focuses on tissue specimens rather than routine CBC testing. Question 56. Before proceeding with the draw, which department usually performs patient and APTT coagulation testing while preparing a electrolyte panel specimen in the long-term care unit? Option A. Urinalysis only. Option B. Microbiology culture bench only. Option C. Cytology screening only. Option D. Coagulation or hematology coagulation section. The correct answer is option D. Coagulation or hematology coagulation section. Coagulation testing evaluates clotting pathways and is commonly handled in a coagulation section. Urinalysis focuses on urine specimens. Microbiology culture benches identify organisms rather than routine clotting times. Cytology examines cells for diagnostic changes, not standard coagulation studies. Question 57. During a scenario, which department is most associated with blood cultures while preparing a therapeutic drug level specimen in the mobile collection site? Option A. Microbiology. Option B. Blood bank compatibility only. Option C. Histology tissue processing. Option D. Chemistry electrolyte analysis only. The correct answer is option A. Microbiology. Microbiology processes cultures to detect and identify microorganisms. Blood bank testing focuses on transfusion compatibility. Histology processes tissue rather than blood culture bottles. Chemistry analyzes chemical constituents and is not the main culture department. Question 58. In the emergency department bay, which department commonly performs type and screen testing in the emergency department bay during a competency review? Option A. Microbiology only. Option B. Blood bank or transfusion services. Option C. Chemistry only. Option D. Parasitology stool testing only. The correct answer is option B. Blood bank or transfusion services. Blood bank testing supports transfusion safety by determining blood type and antibody screen results. Microbiology focuses on infectious organisms. Chemistry focuses on analytes such as glucose and electrolytes. Parasitology stool testing does not perform transfusion compatibility testing. Question 59. For a ammonia collection, which department commonly analyzes electrolytes such as sodium and potassium in the physician office lab during a final review? Option A. Histology. Option B. Blood bank compatibility bench. Option C. Chemistry. Option D. Cytogenetics only. The correct answer is option C. Chemistry. Chemistry measures dissolved analytes such as electrolytes, enzymes, hormones, and metabolites. Histology focuses on tissues. Blood bank compatibility testing is not the routine electrolyte section. Cytogenetics focuses on chromosomes or genetic studies, not routine electrolytes. Question 60. To protect patient safety, which practice is part of phlebotomy quality assurance while preparing a lactate specimen in the community health screening event? Option A. Ignoring mislabeled specimens if the patient is well known. Option B. Changing tube labels after results are reported. Option C. Skipping competency checks for experienced staff. Option D. Tracking specimen errors and using corrective action to prevent recurrence. The correct answer is option D. Tracking specimen errors and using corrective action to prevent recurrence. Quality assurance identifies errors and improves processes so patients receive reliable results. Familiarity with a patient does not make a mislabeled specimen acceptable. Changing labels after reporting hides errors and compromises traceability. Competency checks help maintain consistent safe practice for all staff. Question 61. Why are competency assessments important for phlebotomists while preparing a CBC specimen in the preoperative testing area? Option A. They verify that staff can perform required skills safely and consistently. Option B. They replace all written procedures. Option C. They allow staff to ignore order of draw. Option D. They are only for patients who complain. The correct answer is option A. They verify that staff can perform required skills safely and consistently. Competency assessment supports safe patient care and consistent specimen quality. Written procedures are still needed as standards for practice. Order of draw remains important regardless of competency status. Competency is a proactive quality process, not only a reaction to complaints. Question 62. When preparing for collection, which errors should be reported through the facility's quality process while preparing a patient/INR specimen in the Oncology Infusion Center? Option A. A patient correctly states their date of birth. Option B. A specimen collected in the wrong tube type. Option C. A tube is mixed according to instructions. Option D. A needle safety device is activated after use. The correct answer is option B. A specimen collected in the wrong tube type. Wrong tube collection can cause test cancellation or inaccurate results and should be tracked for improvement. Correct identity confirmation is expected practice, not an error. Proper tube mixing supports quality. Activating a safety device after use is the intended safety behavior. Question 63. In a routine phlebotomy scenario, which activity is commonly associated with CLIA waived point-of-care testing while preparing a basic metabolic panel specimen in the dialysis-adjacent clinic? Option A. Changing the test procedure to save time. Option B. Reporting results without controls when controls are required. Option C. Following manufacturer instructions and documenting quality control for a simple approved test. Option D. Using expired test strips because they look normal. The correct answer is option C. Following manufacturer instructions and documenting quality control for a simple approved test. Waived testing is simple but still requires following instructions, QC, and documentation. Modifying the procedure can invalidate the test category and results. Skipping required controls undermines result reliability. Expired strips may produce inaccurate results even if they look acceptable. Question 64. Before performing a fingerstick glucose test, which step supports accurate point-of-care results while preparing a blood culture specimen in the student skills lab? Option A. Use a strip from an unlabeled loose container. Option B. Skip patient identification because the device stores results. Option C. Apply disinfectant and test before the site dries. Option D. Confirm test strip expiration and run required quality control according to policy. The correct answer is option D. Confirm test strip expiration and run required quality control according to policy. Expiration checks and QC help ensure the device and strips are producing reliable results. Loose unlabeled strips may be expired or contaminated. Device storage does not replace identifying the patient. Testing before the site dries can contaminate or dilute the sample. Question 65. Why must abnormal point-of-care results be handled according to facility policy while preparing a fasting glucose specimen in the occupational health clinic? Option A. Critical or unexpected results may require confirmation, documentation, or immediate notification. Option B. Abnormal results should always be erased. Option C. Only normal results belong in the medical record. Option D. The patient should interpret the result without staff involvement. The correct answer is option A. Critical or unexpected results may require confirmation, documentation, or immediate notification. Policies define how to verify, document, and communicate results that may affect patient care. Erasing abnormal results hides clinically important information. Both normal and abnormal results may require documentation. Patients should receive appropriate clinical guidance rather than interpreting serious results alone. Question 66. In the blood collection station, which blood component is primarily responsible for carrying oxygen in the blood collection station during a practice drill? Option A. Sodium citrate in plasma. Option B. Hemoglobin inside red blood cells. Option C. Platelet granules only. Option D. Tube separation gel. The correct answer is option B. Hemoglobin inside red blood cells. Hemoglobin within red blood cells binds and transports oxygen throughout the body. Sodium citrate is a tube additive, not an oxygen carrier. Platelets help hemostasis but do not primarily transport oxygen. Separation gel is part of a tube system, not a blood component. Question 67. For a lipid panel collection, which blood component is most directly involved in forming the initial platelet plug in the outpatient clinic during a scenario? Option A. Albumin only. Option B. Glucose molecules. Option C. Platelets. Option D. Chloride ions. The correct answer is option C. Platelets. Platelets adhere and aggregate at injury sites to begin primary hemostasis. Albumin helps maintain oncotic pressure and transport substances but is not the platelet plug. Glucose is an energy source, not a clotting cell fragment. Chloride is an electrolyte and does not form platelet plugs. Question 68. To protect patient safety, which vessel type is normally used for routine venipuncture while preparing a troponin specimen in the hospital unit during morning rounds? Option A. Artery. Option B. Lymphatic duct. Option C. Tendon sheath. Option D. Vein. The correct answer is option D. Vein. Veins are lower pressure vessels that are routinely accessed for diagnostic blood collection. Arterial puncture is a different procedure and not routine venipuncture. Lymphatic ducts do not provide venous blood specimens. A tendon sheath is not a blood vessel and must be avoided. Question 69. Why is the basilic vein approached with extra caution while preparing a thyroid panel specimen in the urgent care laboratory? Option A. It lies near nerves and arteries in the antecubital area. Option B. It contains no venous blood. Option C. It always has a built-in tourniquet. Option D. It cannot be palpated in any patient. The correct answer is option A. It lies near nerves and arteries in the antecubital area. The basilic area has nearby structures that increase the consequence of poor needle placement. The basilic vein does contain venous blood. No vein has a built-in tourniquet. The vein may be palpable, but caution is still needed because of anatomy. Question 70. When preparing for collection, which term describes stopping bleeding after vessel injury while preparing a hemoglobin A1C specimen in the pediatric clinic? Option A. Hemolysis. Option B. Hemostasis. Option C. Glycolysis. Option D. Hemoconcentration. The correct answer is option B. Hemostasis. Hemostasis is the process that stops bleeding through vascular response, platelets, and coagulation. Hemolysis is red cell rupture. Glycolysis is glucose metabolism by cells. Hemoconcentration is increased concentration of blood components from fluid shifts. Question 71. A clotted lavender tube is received for CBC testing. Why is recollection usually needed while preparing an electrolyte panel specimen in the long-term care unit? Option A. Clotting proves the patient was fasting. Option B. Clots improve automated CBC accuracy. Option C. Clots trap cells and make cell counts unreliable. Option D. Lavender tubes are supposed to clot before testing. The correct answer is option C. Clots trap cells and make cell counts unreliable. CBC testing requires a well-mixed anticoagulated specimen so cells remain evenly suspended. Fasting status is unrelated to clot formation in an EDTA tube. Clots can block analyzers or distort cell counts. Lavender tubes contain EDTA and should not clot when properly mixed and filled. Question 72. An underfilled light blue tube arrives for patient testing. What is the main concern while preparing a therapeutic drug level specimen in the mobile collection site? Option A. The specimen will become a blood culture. Option B. The tube will automatically refill in the lab. Option C. The patient's identity becomes verified. Option D. Excess citrate relative to blood may alter coagulation results. The correct answer is option D. Excess citrate relative to blood may alter coagulation results. Underfilling changes the anticoagulant to blood ratio and can make coagulation results inaccurate. A citrate tube cannot become a blood culture bottle. Tubes do not refill after collection. Fill volume has no role in verifying identity. Question 73. During a review, which additive can falsely increase potassium if carried into a chemistry tube while preparing a bilirubin specimen in the emergency department bay? Option A. Potassium EDTA. Option B. Clot activator gel only. Option C. Sodium fluoride without potassium. Option D. Sterile culture broth only. The correct answer is option A. Potassium EDTA. Potassium EDTA carryover can contaminate chemistry specimens and falsely elevate potassium while lowering calcium. Gel itself does not add potassium in the same way EDTA contamination does. Sodium fluoride is associated with glucose preservation, not potassium EDTA effects. Culture broth is used for organism recovery and is not the classic potassium carryover problem. Question 74. In the physician office lab, which tube should generally be collected before a lavender EDTA tube in venipuncture order in the physician office lab during a mock exam? Option A. Gray fluoride tube after lavender only. Option B. Green heparin tube. Option C. Another lavender tube for every test. Option D. No tube because EDTA always comes first. The correct answer is option B. Green heparin tube. In the standard sequence, heparin tubes are collected before EDTA tubes to limit additive carryover effects. Gray tubes generally follow EDTA, not precede it as the key before lavender tube. Collecting another lavender tube does not answer the order requirement. EDTA does not always come first and can interfere with later tests. Question 75. For a lactate collection, which instruction is commonly given for a fasting blood test unless policy says otherwise in the community health screening event during a skills check? Option A. Drink sugary beverages before arrival. Option B. Chew gum with sugar during the fast. Option C. Avoid food and most beverages except water for the required fasting period. Option D. Eat a small snack because it will not matter. The correct answer is option C. Avoid food and most beverages except water for the required fasting period. Fasting helps standardize results for tests affected by recent food intake. Sugary beverages can alter glucose and other chemistry results. Sugared gum can break the fast for some testing instructions. A snack can invalidate fasting status for tests that require it. Question 76. If a timed specimen is collected late, which action is most appropriate while preparing a CBC specimen in the preoperative testing area? Option A. Write the scheduled time on the label anyway. Option B. Discard the requisition without telling anyone. Option C. Change the patient's medication schedule independently. Option D. Document the actual collection time and notify the appropriate person according to policy. The correct answer is option D. Document the actual collection time and notify the appropriate person according to policy. Actual collection time is necessary to interpret timed results and decide whether recollection is needed. Writing the scheduled time is inaccurate documentation. Discarding the order without communication disrupts care. Medication timing decisions are outside routine phlebotomy authority. Question 77. After reviewing the order, which action increases the chance of blood culture contamination while preparing a patient/INR specimen in the Oncology Infusion Center? Option A. Repulpating the cleansed site with an unclean glove before needle insertion. Option B. Allowing antiseptic to dry. Option C. Using sterile culture bottles. Option D. Collecting cultures before other tubes. The correct answer is option A. Repulpating the cleansed site with an unclean glove before needle insertion. Touching the disinfected site with an unclean glove can reintroduce skin organisms. Allowing antiseptic to dry supports effective skin preparation. Sterile bottles help maintain specimen integrity. Collecting cultures first helps reduce contamination from other tubes. Question 78. When preparing for collection, which behavior is outside appropriate phlebotomy scope in a routine collection setting while preparing a basic metabolic panel specimen in the dialysis adjacent clinic? Option A. Verifying patient identity. Option B. Interpreting the diagnosis and changing the provider's order independently. Option C. Labeling the specimen at the bedside. Option D. Reporting a specimen problem to the supervisor. The correct answer is option B. Interpreting the diagnosis and changing the provider's order independently. Phlebotomists collect and handle specimens but do not independently diagnose or alter provider orders. Identity verification is a core phlebotomy responsibility. Bedside labeling is expected practice. Reporting problems supports patient safety and quality assurance. Question 79. A patient asks when results will be ready. Which response is most appropriate while preparing a blood culture specimen in the student skills lab? Option A. Guess a diagnosis from the tube color. Option B. Promise exact results in 5 minutes for every test. Option C. Explain that the laboratory or provider will report results according to facility process. Option D. Tell the patient results are not their concern. The correct answer is option C. Explain that the laboratory or provider will report results according to facility process. The phlebotomist can provide general process information without interpreting or promising results outside their role. Tube color does not allow diagnosis. Turnaround time varies by test and setting, so a universal promise is unsafe. Dismissive language is unprofessional and does not support patient-centered care. Question 80. Before proceeding with the draw, which disposal choice is correct for blood-soaked gauze after a draw while preparing a fasting glucose specimen in the occupational health clinic? Option A. Place it in the sharps container. Option B. Put it in a clean supply drawer. Option C. Hand it to the next patient to hold. Option D. Place it in the appropriate biohazard waste container according to policy. The correct answer is option D. Place it in the appropriate biohazard waste container according to policy. Blood-contaminated soft waste belongs in the designated biohazard stream when required by policy. Sharps containers are reserved for needles and other sharps, not soft gauze. A supply drawer must remain clean and uncontaminated. Giving contaminated gauze to another patient creates exposure risk. Question 81. During a structured exam prep drill, which item should never be stored with clean blood collection supplies while preparing a type and screen specimen in the blood collection station? Option A. Used needles or blood-contaminated materials. Option B. Unopened sterile needles. Option C. Unexpired evacuated tubes. Option D. Clean tourniquets ready for use. The correct answer is option A. Used needles or blood-contaminated materials. Clean supplies must be protected from contamination to prevent patient exposure and specimen problems. Unopened sterile needles are appropriate clean supplies when stored correctly. Unexpired tubes belong with clean collection inventory. Clean tourniquets can be stored for patient use if facility policy permits. Question 82. Why should a phlebotomist follow the facility procedure manual rather than personal shortcuts while preparing a lipid panel specimen in the outpatient clinic? Option A. Shortcuts are always faster and safer. Option B. Standard procedures support consistent safety, quality, and regulatory compliance. Option C. Procedure manuals are only for new employees. Option D. Regulations do not apply to outpatient settings. The correct answer is option B. Standard procedures support consistent safety, quality, and regulatory compliance. Written procedures create a consistent standard that reduces variation and errors. Shortcuts can bypass safety checks and increase risk. Experienced staff are also expected to follow current procedures. Regulatory and safety expectations apply across collection settings. Question 83. For a troponin collection, which action helps prevent leakage during specimen transport in the hospital unit during morning rounds during a review? Option A. Loosen the stopper to release pressure. Option B. Carry open tubes by hand. Option C. Ensure the tube is closed securely and placed in approved transport packaging. Option D. Place tubes loose in a coat pocket. The correct answer is option C. Ensure the tube is closed securely and placed in approved transport packaging. Secure closure and proper packaging protects staff, couriers, and specimen integrity. Loosening the stopper can cause leaks and exposure. Open tubes increase spill and contamination risk. A coat pocket is not approved specimen transport packaging. Question 84. A serum tube and lavender tube are ordered after blood cultures and citrate, which should be collected first while preparing a thyroid panel specimen in the urgent care laboratory. Option A. Lavender before serum. Option B. Gray before both in every case. Option C. Order does not matter if both are mixed. Option D. Serum tube before lavender tube. The correct answer is option D. Serum tube before lavender tube. Serum tubes are collected before EDTA tubes to reduce EDTA carryover into chemistry specimens. Lavender first can contaminate the serum tube with EDTA. Gray tubes are generally later in the order and are not automatically before serum. Mixing tubes does not correct additive carryover. Question 85. After reviewing the order, which tube is most associated with ESR testing in many phlebotomy settings in the pediatric clinic during a skills check? Option A. Lavender EDTA tube or designated black citrate tube depending on method. Option B. Blood culture bottle only. Option C. Gray fluoride tube for every ESR. Option D. SST for all ESR methods. The correct answer is option A. Lavender EDTA tube or designated black citrate tube depending on method. ESR collection depends on the facility method, commonly EDTA or a designated citrate ESR tube. Blood culture bottles are for microbiology cultures. Gray fluoride tubes are not the usual universal ESR container. SST serum is not appropriate for all ESR methods because ESR evaluates cellular settling. Question 86. Why should serum tubes be allowed to clot before centrifugation unless policy states otherwise in the long-term care unit during a practice drill? Option A. Clotting makes EDTA work faster. Option B. Centrifuging too early can leave fibrin strands and compromise serum quality. Option C. Early centrifugation improves blood culture growth. Option D. Serum tubes contain no blood cells. The correct answer is option B. Centrifuging too early can leave fibrin strands and compromise serum quality. Serum specimens need adequate clot formation so serum separates cleanly after centrifugation. EDTA is not the additive in a serum tube. Blood culture growth is unrelated to serum tube clotting. Serum tubes initially contain whole blood cells before clotting and separation. Question 87. In a routine phlebotomy scenario, which tube should not be centrifuged before it has clotted when serum is required in the mobile collection site during a scenario? Option A. Lavender EDTA tube for CBC. Option B. Light blue citrate tube for patient. Option C. Red top or serum separator tube. Option D. Gray fluoride tube for glucose. The correct answer is option C. Red top or serum separator tube. Serum tubes must clot before centrifugation to obtain clear serum and avoid fibrin problems. Lavender CBC specimens are whole blood and are not clotted for serum. Light blue specimens are anticoagulated plasma for coagulation testing. Gray specimens contain additives for glucose preservation and are not serum clot tubes. Question 88. Before proceeding with the draw, which action is appropriate if a patient has a latex allergy in the emergency department bay during a competency review? Option A. Use latex equipment briefly because exposure is short. Option B. Ignore the allergy if gloves are powder-free. Option C. Ask the patient to hold the latex tourniquet away from the skin. Option D. Use latex-free equipment and follow facility allergy precautions. The correct answer is option D. Use latex-free equipment and follow facility allergy precautions. Latex-sensitive patients require latex-free supplies to prevent allergic reactions. Short exposure can still trigger a reaction. Powder-free latex may still contain latex proteins. Having the patient hold latex does not remove exposure risk. Question 89. During a final review, which mismatch requires resolution before drawing blood in the physician office lab during a final review? Option A. The requisition name does not match the patient's wristband. Option B. The patient is wearing a sweater. Option C. The collection tray has extra gauze. Option D. The phlebotomist has 2 tube holders. The correct answer is option A. The requisition name does not match the patient's wristband. An identity mismatch can lead to a wrong patient specimen and must be corrected before collection. Clothing choice does not create an identification conflict. Extra gauze does not affect patient identity. Having additional clean equipment does not create a patient mismatch. Question 90. During downtime when barcode labels are unavailable, what should guide specimen labeling in the community health screening event during a study session? Option A. No labels until the computer returns. Option B. Approved manual identification and labeling procedure. Option C. Labels borrowed from another patient. Option D. Memory of the patient after the shift. The correct answer is option B. Approved manual identification and labeling procedure. Downtime procedures are designed to maintain traceability when electronic systems are unavailable. Unlabeled specimens are unsafe and may be rejected. Borrowed labels cause wrong patient errors. Memory after the shift is not a reliable labeling method. Question 91. For a CBC collection, which action reduces sharps injury risk immediately after withdrawing the needle? Option A. Carry the exposed needle to the lab. Option B. Set the exposed needle on the bed. Option C. Activate the safety feature as designed and dispose of the device promptly. Option D. Hand the exposed needle to a coworker. The correct answer is option C. Activate the safety feature as designed and dispose of the device promptly. Safety activation and prompt disposal isolate the sharp before it injures someone. Carrying an exposed needle increases injury risk during transport. A bed is not a safe surface for a contaminated sharp. Passing an exposed needle puts the coworker at risk. Question 92. Why should reusable tourniquets be cleaned or replaced according to policy in the Oncology Infusion Center during a clinical simulation? Option A. They change venous blood into serum. Option B. They make citrate tubes underfill. Option C. They replace the need for gloves. Option D. They can become contaminated between patients. The correct answer is option D. They can become contaminated between patients. Tourniquets contact patient skin and the environment, so cleaning or single patient use prevents cross-contamination. A tourniquet does not determine whether blood becomes serum. Citrate tube fill depends on collection volume and vacuum, not tourniquet cleaning. Gloves are still needed when blood exposure is possible. Question 93. After reviewing the order, which action helps keep a cleaned venipuncture site uncontaminated in the dialysis adjacent clinic during a review? Option A. Do not touch the site again unless replicating with a sterile or policy-approved method. Option B. Fan the site with the requisition. Option C. Place the used alcohol pad back on the site. Option D. Scratch the site to improve blood flow. The correct answer is option A. Do not touch the site again unless replicating with a sterile or policy-approved method. Avoiding recontamination preserves the effect of skin antisepsis before puncture. Fanning with paperwork can introduce contaminants. A used alcohol pad is contaminated after use. Scratching damages skin and contaminates the puncture area. Question 94. When preparing for collection, which situation requires immediate cleanup or removal from the draw area in the student skills lab during a mock exam? Option A. A sealed sterile needle in its package. Option B. A contaminated needle holder or blood on the work surface. Option C. A printed order in the correct patient's chart. Option D. A clean unopened gauze packet. The correct answer is option B. A contaminated needle holder or blood on the work surface. Contaminated surfaces and equipment can expose staff and patients to blood-borne pathogens. A sealed sterile needle package is clean until opened. A correctly placed order does not create a contamination hazard. Clean unopened gauze is appropriate collection supply. Question 95. In a routine phlebotomy scenario, which documentation habit is most defensible after an unsuccessful draw attempt? Option A. Erase the attempt because no specimen was obtained. Option B. Chart that the patient refused even if they did not. Option C. Record the attempt and outcome according to facility policy. Option D. Blame the patient in informal language. The correct answer is option C. Record the attempt and outcome according to facility policy. Accurate documentation creates a truthful record and supports continuity of care. Deleting the attempt hides relevant clinical information. False refusal documentation is unethical and inaccurate. Informal blame language is unprofessional and not objective. Question 96. How many venipuncture attempts should a phlebotomist make before seeking help in the blood collection station during a practice drill? Option A. Unlimited attempts if the patient is quiet. Option B. 10 attempts before reporting difficulty. Option C. No limit when tubes are urgent. Option D. Follow facility policy, commonly limiting attempts before asking another qualified person. The correct answer is option D. Follow facility policy, commonly limiting attempts before asking another qualified person. Attempt limits protect patients from unnecessary pain, bruising, and complications. A quiet patient may still be harmed by repeated attempts. 10 attempts is excessive for routine phlebotomy. Urgency does not eliminate safety limits or escalation procedures. Question 97. A fasting patient asks whether water is usually allowed. How should the phlebotomist respond in the outpatient clinic during a scenario? Option A. Explain that water is commonly allowed unless the specific instructions or provider say otherwise. Option B. Tell the patient water always ruins every test. Option C, encourage juice because it keeps veins full. Option D, say hydration never affects blood draws. The correct answer is option A. Explain that water is commonly allowed unless the specific instructions or provider say otherwise. Water is often permitted during fasting and can support hydration, but the exact instruction depends on the ordered test and policy. Water does not automatically ruin fasting laboratory tests. Juice contains sugar and can affect fasting analytes. Hydration can affect vein access, so it is not irrelevant. Question 98. In the hospital unit during morning rounds, which tube additive prevents glycolysis after collection? Option A, silica clot activator only. Option B, sodium fluoride. Option C, EDTA for morphology only. Option D, SBS for blood cultures only. The correct answer is option B. Sodium fluoride. Sodium fluoride inhibits glycolysis, helping stabilize glucose in the specimen. A clot activator promotes clotting rather than inhibiting glycolysis. EDTA preserves cells but is not the classic glycolysis inhibitor. SBS is used in blood culture collection and is not the routine glucose preservative. Question 99. For a thyroid panel collection, which tube should usually be collected last among serum, green, lavender, and gray tubes? Option A, serum tube. Option B, green tube. Option C, gray tube. Option D, lavender tube. The correct answer is option C. Gray tube. Gray tubes are generally placed near the end of the venipuncture order of draw after EDTA. Serum tubes are collected before heparin, EDTA, and gray tubes. Green heparin tubes are collected before EDTA and gray tubes. Lavender EDTA tubes usually come before gray tubes. Question 100. To protect patient safety, which specimen problem is most likely when blood is drawn too forcefully through a tiny needle? Option A, improved clotting factor stability. Option B, perfect blood culture sterility. Option C, automatic chain of custody. Option D, hemolysis. The correct answer is option D. Hemolysis. Excessive force through a small needle can rupture red blood cells and cause hemolysis. Forceful collection does not improve coagulation factor stability. Sterility depends on aseptic technique and collection system. Chain of custody requires documentation, not collection force.